Baton Rouge Business Report this month. You'll see healthcare professionals to watch in 2025. One of those, Dr. Jeremy Burnham. He joins us every other Monday and does so now at Sports Health, presented by Ochsner Andrews Orthopedics and Sports Medicine Institute. Dr. Burnham, thanks for the time. How are you?
Hey, I'm doing great. Thanks for having me.
It's our pleasure. Three of the scariest letters in sports are ACL, and obviously in any sport you hear that and you fear the worst. That's going to be, generally speaking, at least a year away from competition. And we were talking a little bit before the show, and you mentioned that ACL tears are used the word skyrocketing in high school sports. I know there are a lot of people listening that have youth athletes. Can you kind of speak to that a little bit and just what you're seeing?
Yeah, it really is skyrocketing, Hunt, and there are a lot of reasons behind it. We don't know every single one of those reasons. We know that it's more common in female high school athletes for some reason. So maybe 7 to 8 times higher risk for female high school athletes than for male athletes. I think part of it is we're seeing some association with just specializing in a single sport maybe too early. It seems like athletes that are playing multiple sports don't have that same risk. I think they're getting more balanced strength and conditioning, whereas if you're playing the same sport and especially the same position 12 months a year, you're putting a lot more stress on your ligaments and your joints than otherwise. So that may play a role as well.
Yeah, that's interesting because a lot of times when I hear about specialized athletes, you hear about burnout and kids just decide they don't want to do that anymore because that's all they're doing. But also there could be some injury risk to that as well, which I found interesting. But I think obviously when the damage is done, the damage is done. But there are things that y'all are looking into on the front end preventatively that may be able to slow this down a little bit. Can you speak to that with knee injuries?
Yeah, I think the thing with ACL tears is that even though the treatments have gotten a lot better and we understand each year that goes by, there's more science that comes out and we can treat these injuries better. At the end of the day, if you tear your ACL, you're still going to miss significant time out of your sport. There's still a lot of downtime, a lot of rehab that has to be done. So our focus has really been, in addition to trying to provide that, cutting edge treatment when you do tear your ACL, but really has been trying to catch these patients before they tear their ACL. And so we've done a lot of research, and this is really, over the last 5 to 6 years that we've been doing this, but really starting to see the results of it over the last year or two, is trying to find the things that identify patients that are at a high risk for ACL tear. And so, for instance, we have a 2-minute test that's done very easily without any fancy equipment. You can actually, you could go do it in any athletic training room or, any coach across Louisiana could learn this test very quickly and do it. And then you can identify the patients that are in the bottom 25% in performance on that test, and those people have a 4 times higher risk of tearing their ACL in the subsequent season. And so we're trying to go through and identify, catch those athletes, give that information to the coaches, and then make some interventions that actually will cut back on injury risk.
Sometimes when I ask questions, I fear how ignorant that they may sound, but we'll see how this one sounds. As far as an ACL tear goes, I know we've talked about the fact that sometimes it can happen over time and then boom, it goes at the last instant. Is there anything that you can tell in a lead up to it, or is it just someone that maybe I'm not asking that properly, but you understand where I'm getting? Like, can you catch something before it happens?
You can, and there's always been these kind of eyeball tests that people would say where they can identify, and sports medicine professionals say, oh, that person looks like they're at a higher risk. And what we really try to do is take that eyeball test and really nail it down objectively and say, okay, what are we seeing and can we measure those things and be consistent about it? And a simplified way of saying it is that when people land in a jump, if their knees dip in, that's one of the big risk factors. That's something that's called valgus is the medical term. But we know that when people's knees dip in when they land, that they're at a higher risk for ACL tear. There's a lot of reasons they dip in like that. A lot of it comes from the hip muscles way up high, but that controls the whole leg. And so part of the injury prevention protocol is just, teaching people how to land correctly in a way that their knee is not in as high risk of a position.
I drove by Elite this morning, was picking up my wife from getting her car worked on over there on Burbank. Can you tell us what's the latest over there?
Yeah, look, we just finished up, pre-participation physical season. We've done physicals on over 700 high school athletes over the last several weeks. About 300 of those were this past Saturday. We brought out a team of about 30 or 40 people. That included, physicians, PAs, physical therapists, strength and conditioning coaches, athletic trainers, and we all work together to do these pre-participation physical exams. And we also did injury screening on about 150 of those kids. And so really quite a few that we're able to bring through and help give some input on what's going on from an injury risk standpoint. And, every year at these physicals is great because, number one, we just get to, make sure that someone's general health is good. We get to educate them on some things that will lower their injury risk in the future. And fortunately, every year or two, we're able to catch some things early on that result in some medical intervention that really makes a difference in somebody's life. And so that's really what it's all about, is trying to make a difference in the community and keep our community safe.
Incredible resource for our community here in Baton Rouge, Elite, right over there on Burbank. Dr. Burnham, I know you're traveling up to our nation's capital this week. Safe travels, and we'll talk in a couple of weeks. We appreciate the time.
Thank you. Talk to you soon. Hi.
He is Dr. Jeremy Burnham over there at Oxford. Dr. Andrews Orthopedic and Sports Medicine Institute. We know that sports injuries can be unpredictable, but one situation you can protect yourself from is heat illness. We know that heat is coming, and it stays around for a long time. Some keys to look for maybe excessive sweating, dry mouth, dizziness, fast heart rate, change in mental status. If you feel any of these symptoms, stop physical activity immediately. Find a place to cool off and replenish fluids. To learn more about any sports injury prevention and treatment, visit oxford.org/BR Ortho.